What's up, everyone? It's Haley, and today we're diving into a topic that's incredibly important, not just for those of us in the medical field, but really for anyone who has ever been a patient. If you work in healthcare, there are strict rules you must follow. These aren't just arbitrary guidelines or bureaucratic red tape. They are honestly the bedrock of the entire healthcare system. Think about it. When you go to a doctor or a hospital, you're placing your health, your privacy, and sometimes even your very life into someone else's hands. That's a profound level of vulnerability, and it requires an equally profound level of trust. This trust isn't automatic, it's earned. It's built and maintained every single day through a commitment to a strict code of conduct. The rules we're going to talk about today are designed to protect that sacred bond between patient and provider. They ensure that every patient receives safe, ethical, and compassionate care. Following these rules isn't just about avoiding lawsuits or keeping your license. It's about upholding the integrity of our profession. It's about making sure that when someone is at their most vulnerable, they can be confident they are in safe, capable, and trustworthy hands. So, whether you're a seasoned professional, a student just starting your journey in healthcare, or simply a curious viewer, understanding these boundaries is crucial. We're going to break down some of the biggest what not to do's for healthcare workers. These are the lines that should never be crossed, the actions that can shatter patient trust and cause serious harm. Let's get into it, because knowing the rules is the first step to providing the best possible care. First up, and this is a massive one, is sharing patient information without consent. We've all heard the term HIPAA, the Health Insurance Portability and Accountability Act, but it's more than just an acronym we have to learn for an exam. It's a legal and ethical fortress built around a patient's private health information. Think about the sensitive details you share with your doctor, your medical history, your anxieties, your test results. This information is yours and yours alone. As healthcare workers, we are sworn guardians of that information, not gatekeepers who get to decide who hears it. It's a fundamental right to privacy. This means you can't go home and tell your partner about a fascinating case you saw, even without using names. You can't post a vague but identifiable story on social media about a patient's condition. You can't even discuss a patient's case in a public elevator where others might overhear. The consequences for violating HIPAA are severe, ranging from hefty fines to job loss and even criminal charges. But beyond the legal penalties, the damage to patient trust is immeasurable. Once that confidentiality is broken, it's nearly impossible to repair, undermining the very foundation of the patient-provider relationship. Next, let's talk about something that can seem harmless on the surface: accepting gifts or bribes from patients. A grateful patient might want to give you a small token of their appreciation, like a box of chocolates or a thank you card, and that's usually okay. But where do we draw the line? The issue arises when a gift could be seen as an attempt to influence care. This is what we call a conflict of interest. Accepting a significant gift, like a large sum of money, expensive jewelry, or tickets to a big game, creates an ethical minefield that can compromise your professional judgment. It introduces an unfair dynamic. Does this patient now expect special treatment? Will you subconsciously prioritize them over other patients who haven't given you a gift? It blurs the professional boundaries that are essential for objective, equitable care. Your decisions should be based solely on medical necessity and clinical judgment, not on who gave you the nicest present. The best way to handle this is to have a clear policy and to politely decline substantial gifts, explaining that your commitment to providing the best care for all your patients is the only thing that matters. Your professional integrity is not for sale at any price. This next point should be obvious, but it needs to be said loud and clear. You must never, ever discriminate against patients. Healthcare is a human right, and our role as providers is to deliver the best possible care to every single person who walks through our doors, period. It doesn't matter what their race, religion, gender identity, sexual orientation, socioeconomic status, or political beliefs are. A patient is a patient. Their health and well-being are the only things that should be on our minds when we are treating them. Prejudice and bias have absolutely no place in a clinic or hospital. Allowing personal beliefs to influence clinical decisions is not only unethical, it's dangerous. It can lead to substandard care, misdiagnoses, and a complete erosion of trust, not just with that one patient, but with entire communities. We have a professional and moral obligation to create a safe, welcoming, and inclusive environment for everyone. Empathy is one of the most powerful tools in our medical kits, and it must be applied universally. Equal treatment isn't just a nice idea, it's a non-negotiable standard of professional practice. Now, let's discuss the concept of scope of practice. This is a critical rule that means you cannot perform procedures or make medical decisions that are outside of your specific qualifications and licensure. A registered nurse, for example, has a different scope of practice than a physician, which is different from a paramedic or a medical assistant. These scopes are clearly defined by law and by professional boards for one primary reason: patient safety. You might be a highly skilled and knowledgeable professional, but that doesn't give you a license to freelance outside your designated role. Trying to perform a procedure you haven't been trained for, even with the best intentions, can have catastrophic consequences. It's like a pilot trying to perform air traffic control duties. They might know a lot about aviation, but they lack the specific, crucial training for that role. Overconfidence can be deadly in medicine. It's vital to know your limits and to respect the expertise of your colleagues. Part of being a good healthcare professional is knowing when to say, "This is beyond my scope of practice, but I will get you the right person who can help." Humility saves lives. This one is a daily, hourly, sometimes even minute-by-minute responsibility: ignoring safety protocols. In healthcare settings, we're constantly battling invisible enemies: bacteria, viruses, and other pathogens. Simple, routine safety measures are honestly our most powerful weapons in this fight. Things like meticulous hand hygiene, correctly wearing personal protective equipment like gloves and masks, and following strict infection control procedures are just not optional. They are the absolute baseline for preventing the spread of disease and protecting both patients and ourselves. I know it can be really tempting to cut corners when you're busy, tired, and have a dozen other things to do. Maybe you forget to wash your hands between patients or decide not to wear gloves for a quick task. But every single one of these small lapses creates an opportunity for a healthcare-associated infection. These infections can cause severe complications, prolong hospital stays, and can even be fatal for vulnerable patients. Following safety protocols every single time is a demonstration of your respect for your patients and your colleagues. It's a discipline that shows you take your role as a protector of health seriously. Let's move on to the patient's medical record. This document is not your personal diary. It's a legal document. And that brings us to our next major: don't never, ever falsify medical records. This means you don't invent symptoms, you don't change test results, you don't omit crucial information, and you definitely don't chart a procedure that you didn't actually perform. The medical record is the official story of a patient's health journey. It's used by the entire care team to make critical decisions. It's used for billing and insurance, and it's even used as evidence in legal proceedings. Altering that record is a profound betrayal of trust and has severe consequences. Legally, it's considered fraud and can lead to criminal prosecution, massive fines, and the permanent loss of your medical license. Ethically, it's a disaster. It can lead to incorrect diagnoses, harmful treatments, and serious patient injury. If you make a mistake, and honestly we all do, the correct procedure is to document it honestly and follow your institution's protocol for correcting errors. Trying to cover it up by falsifying the record only digs a deeper hole and puts your patient at immense risk. Honesty and accuracy are just non-negotiable. Finally, we need to talk about something very serious: working while impaired. This means coming to work under the influence of alcohol, illicit drugs, or even prescription medications that affect your judgment, coordination, or cognitive abilities. As healthcare professionals, we are expected to be sharp, focused, and capable of making clear-headed decisions, often under immense pressure. Being impaired completely compromises this ability. It dulls your senses, slows your reaction time, and clouds your clinical reasoning. The danger this poses to patients is astronomical. Imagine a surgeon with trembling hands, a nurse who miscalculates a medication dosage, or a doctor who misses the subtle signs of a critical illness because their mind is foggy. The risk of making a devastating, life-altering mistake is incredibly high. Healthcare is a demanding profession, and burnout and stress are real. If you are struggling with substance use, it is not a sign of weakness to seek help. It is actually a sign of strength and responsibility. Your health and well-being matter, and taking care of yourself is the first step to being able to take care of others safely. So, we've covered a lot of ground today, from the legalities of HIPAA to the fundamental ethics of patient care. It might seem like a long list of restrictions, but it's so much more than that. These rules are the guardrails that keep us on the path of providing safe, effective, and compassionate medicine. They are the framework that allows the public to place their trust in us during their most vulnerable moments. Following them is not about avoiding punishment. It's about actively choosing to do the right thing every time for every patient. This is the promise we make when we decide to enter this field. Remember, these rules protect both patients and healthcare workers. Always follow them to ensure the best care. They protect patients from harm, and they protect us from the legal and moral consequences of making a preventable mistake. They create a standard of excellence that elevates the entire profession. Whether you're dealing with a difficult case, feeling the pressure of a long shift, or facing an ethical dilemma, these principles should be your North Star, guiding your decisions and actions. Upholding them is the ultimate sign of respect for your patients, your colleagues, and yourself. Thank you so much for watching and for taking the time to engage with this incredibly important topic. If you're in healthcare, what are some other rules you think are absolutely essential? Let me know in the comments below. Let's keep this conversation going. And as always, stay healthy, stay curious, and I'll see you in the next video.